Hey guys, welcome to pre-hospital cardiac ultrasound. We thought we'd put together a quick little presentation for you here to help guide you through some of the highlights and key points to using the ultrasound when you're called to a cardiac arrest on the Jeep. So this is the device that we'll be using. This is the iVis by Sonosite. You can see here this is the standard cardiac phased array probe that we're used to for cardiac scans in the ED. This is attached via this cord to a tablet. This Android device-like tablet is in this nice screen protector with a hand holder that you can see there on the right. You can flip this thing to your left or right hand depending on which you prefer to scan with, and the screen changes its orientation based on an accelerometer, much like you're used to with your cell phones. You note the power button on this device is indicated by the green arrow. On the bottom corner there, you tap and hold for a few seconds to turn this thing on. Again, just like you're used to with a cell phone or tablet. How nice. This thing has a kickstand as well if you're not really comfortable holding the device and scanning when you're on the scene. You can prop this thing up and set it on the ground, a table, or patient's belly, or whatever you feel like doing. When you turn on the device and unlock it, this is going to be really one of the first screens that you see. You've got options here to tap patient, where you enter in patient information, tap scan, it just starts scanning right away. You've got some more advanced options too there on the right. Again, the format or setup of the buttons that you can kind of see is in the Android platform. Sorry, Apple users. So as you kind of flip through the option and menus and things like that, you'll kind of notice some similarities to how the information is presented to you. This form that we're showing you here is a copy, a picture of the form that you're going to see in the Jeep. This is our patient de-identifier list that we're ultimately tagging to the different images and clips that you save. What you're going to do here is you're going to see like a green folder where this form is housed, and really you're going to use the next up patient de-identifier and enter that into the patient information on the ultrasound machine itself. And between this form in the Jeep and the ultrasound images you save, we'll be able to link these up here to ultimately identify the images that you end up sending to us. So looking at the ultrasound itself, this is where you're going to enter that patient de-identifier. The patient de-identifier is we prefer here to have under the ID section under the patient information. So I just use the letter A here, but this will be whatever is next up based on that sheet in the Jeep. And we've had several images saved now, so it'll be pretty obvious kind of which is the next line up for you to use. The other information that we would like, this additional information will kind of help us out should we have any trouble locating or matching up your scans. Under the last name section, if you could put the date that the scan was performed, that will be helpful. And then under the first name section, if you could put like roughly the time that you were called, that will be helpful as well. So the ideally time to enter this information would be you show up on the scene, and right before you scan the patient, you know what letter is next up, and you just enter the letter, the date, time you're called that maybe will take like 15, 20 seconds, something like that. But understandably, sometimes you're a little amped up and maybe you forgot to enter in the patient information and you just started scanning away. Never fear, you can still go back and enter patient information after you're done at the scene before this image is, or excuse me, clips and images are ultimately uploaded. Where you end up doing that is you end up going back to the patient information screen, tapping on this button in the top right that says iVis Studies, and you'll end up clicking on the images that you just saved, and you'll be able potentially to kind of edit. Uh, you'll see a form that's similar to the one you see here, and be able to edit some of that information. If you have any questions about how to do that, just let me know. If it ends up trying to upload via the Wi-Fi and it doesn't let you alter that information, that's okay too. Just there'll be a temporary ID associated with it. Just make sure you note that on the paper form as well as on your emscharts.com form so that we can ultimately kind of figure out where your image is and give you credit for it. So kind of going through real briefly some of the logistics about obtaining an image to help improve quality. We have some of our usual suspects. Of course, you can use more gel and pressure and to help improve your image. When it comes to the screen itself here, you've got this roller ball function on the right here. It's going to be hopefully next to your hand. You can change the gain here by tapping on the gain button and then rolling your thumb up and down over the positive and negative portions here in order to adjust your gain to your desire. Similarly with depth, you can do the same. Just make sure you tap the depth button first and then roll up and down in order to increase or decrease the field of vision on your image. An important point to go over here is saving your image. Remember, we're really looking for cardiac motion, so you want to tap and hold this save button for a second or two in order to save an image. If you just tap the button, it'll do a still clip, which really won't be helpful to our ultrasound faculty that are doing a review of your images for quality assurance. So just remember to tap and hold, and it's automated to save a 6-second clip. You'll see as you do this that save button will fill up with like a red bar that'll indicate you're actually saving a video and not just a clip. If you notice on the top left, the preset on this image here is under the OB setting. It should be on cardiac, but if not, for style points, you can change that. It just changes some of the presets that are associated with it. You might get a little better cardiac views if you put it on cardiac. So this is what that drop-down menu looks like. On the back of it is where the battery is located. If your battery's dying, you do carry a backup with you. This is normally located in the black case where there's these foam cutouts to keep the ultrasound nice and tidy and safe. Just remember, it's not always readily apparent that you have to pull out the foam to find the battery spare underneath that. So that's where it is often located. Remember when you're on overnight and you got some downtime, just to be charging these batteries similar, or at least charge the backup, similar to how you charge the Jeep radio that we use. So if you're curious how these results ultimately are uploaded, these scans are the device, excuse me, is synced to the UPMC Wi-Fi network. So these scans are ultimately uploaded over the Wi-Fi to QPath whenever the device is turned on and fully functional in a emergency department. We can also upload them by hand as well. And these scans do count towards your 250. So make sure, again, you kind of put your name on the EMS chart form when you're filling this out, and make sure you put an interpretation with it, and you can get credit towards your cardiac scans. So right now, question might pop in your head: can we use this for other scans? And really, we want you to at least for now focus on cardiac arrest patients. We're hoping to potentially increase its use elsewhere. So if you have other ideas of where it might be useful on the Jeep, let us know, email us, or kind of put that into the EMS charts form. So speaking of EMS charts, you finished your arrest and you're ready to go home and kick back, have a beer, and chart, and you're wondering, I keep referring to this form. What does this thing look like, and how am I supposed to fill it out? So we'll go through that next real quick. This is just a screenshot of what the EMS charts form looks like that you're probably pretty familiar with. Where we've put our ultrasound form is at the end here under the miscellaneous forms tab at the very end. So before you can sign your chart and lock it out, you have to click on the research form that's highlighted here. You'll see next pops up the PMD ultrasound form that when you click, it'll show you this. We'll real briefly just go through each of the different lines, the data that we're looking for here. First off, obviously the first line is, was this a cardiac arrest? Yes or no. If this was not a cardiac arrest, you just check that box as no. You can click save and move on, or you can click really does not apply. That'll let you save the form and close out the chart. Obviously, if this is an arrest, do click yes and move on to the next part here. You can tell us what form or what additional scans might have been helpful on the next line, and then next you'll want to select the initial rhythm. This is what that drop down will look like for the initial rhythm. It shows obviously this is an asystolic arrest, PEA, etc. Whatever it was when you showed up, let us know. Also, you're going to want to let us know what the downtime on arrival was. So when you show up and ask medics, how long has this person been down? And the medics say, Doc, they've been down for maybe 15 minutes, witnessed arrest or unwitnessed arrest, and really we have no idea how long they are down for. Let us know what that is. So say unknown if we have no idea how long they were down. If the medics have a time for you, let us know what that time was there. Next line after that is the cardiac view obtained. We'll advance to the next slide, show you what your options are there. Options are here, really parasternal subxiphoid, apical 4, your parasternal short. You can do multiple views if you're really jazzed about it. Really what we're expecting is just really a quick one view during one of your pulse checks. And most commonly that would seem to make sense as either like a subxiphoid or one of your parasternal views. Next line after that, for your time to obtain images, really this is something that we put the marker in there, wanting it really in terms of seconds, because what we're looking for here is how long is the time from when you put the probe on the patient and it makes skin contact. How long is that until you tap save on the ultrasound machine and have a saved image? So the point of this is really we want we don't want to interrupt compressions with for more than 10 seconds. ACLS recommendation is you do a pulse check and a rhythm check, and that should take about 10 seconds, and then you should be right on the chest and minimizing chest compressions. So if you are unable to obtain an image during that 10-second period, you really should make sure like medics interrupt you and start doing chest compressions, and you would need to troubleshoot whatever it was, whether it was like body habitus and it's hard to do a subxiphoid, and you need to try a different image, view, etc. Maybe the device was malfunctioning or something like that. So that's what we're looking for in terms of the time to obtain images. This is not the time from when you show up on the scene, you get the history, you do everything that you do in an arrest, and then ultimately, eventually get the image. So if you have any questions on that, please let me know. Next options here are some yes or no drop-down boxes for interpretation. Some of the key interpretation points that we're really looking for was, are you detecting cardiac motion, yes or no? And do you feel like you got a good enough image to make that call? So yes or no, adequate image obtained. For the outcome of the resuscitation, this is another drop-down box. It's going to give you options of ROSC or no ROSC. When it comes to determining ROSC or no ROSC, we're really talking specifically about the pre-hospital setting. So basically, when you showed up, if this person was in arrest and you got ROSC and then transported them to the hospital, but then they ultimately died in the emergency department, the answer to this question still is yes, ROSC, because you got ROSC, you transitioned to another provider, and the outcome of your resuscitation in the field was yes, you did get return of spontaneous circulation. As far as the next line after that, you can see there's a free text image interpretation line. Again, this is another place you could put in cardiac motion, yes or no, inadequate image or not, but you can also add in things like pericardial effusion, yes or no. That might be helpful to know and something that you can easily, you should be able to interpret. Sometimes maybe you want to know if there was significantly dilated RV in this arrest versus the LV. If that stood out to you and you felt like you were able to make that image interpretation, you can put that in on the free text line there. And those images, again, are ultimately being forwarded to QPath, where our ultrasound faculty kind of normally reviews them. So they will review your image interpretation there. So again, the next couple lines are the challenges section. Just let us know if you had any challenges such as device malfunction or patient body habitus, etc. Don't forget to include your name so we can give you credit for the scan. And lastly, we ask again if you can remember what that patient de-identifier was. If you can put that there on the form, that is really helpful. Because we can then link up your charts easier. I took a screenshot of the image form that's in the Jeep just to kind of drive home the point that whatever the next letter up is that you put on the images you saved, that's what we're looking for in that line down there. And if, again, have any questions with how to fill out this information, just let me know. So a quick kind of mental walkthrough on the scene with ultrasound. If you're having kind of a hard time wrapping your head around this, maybe this will help. So you're driving to the scene and you're getting all amped up because medics are actively doing compressions, and you're parking the Jeep, flying out of the car, grabbing the blue bag that's next to you. First point there is to remember to also grab the ultrasound. It's in its ultrasound bag that's like a book bag, so you can kind of sling one over one shoulder, sling one over the other shoulder, and make sure to bring it in. It's hard to do it when you don't have it with you. So You figure out which address the patient's actually at, whether they're upstairs, downstairs, whatever, and you show up and you see the medics doing compressions. And what's the first thing you should do? The first thing that you should do is what you guys have been doing, which is go through your ABCs of resuscitation first. So you make sure the patient's on a monitor well, they've got pads attached. If they've been intubated, go through the confirmation process, listen for breath sounds, check the end tidal CO2, make sure that you're timely with your epi administrations, and check about what access you currently have. Get other patient information that might help you figure out why they arrested, etc. That should take you a couple minutes at least. And so after you are going through those things, and really you're getting ready to do your first pulse check, you should start to prepare the ultrasound at that point. And so some of the medics now are becoming more familiar with this, but you should probably prep them about the pulse check with the ultrasound and make sure everyone's kind of on the same page. So you're, laying down or sitting down next to the patient, you're taking it out of the black case or however you arranged your bags before you left, and you're turning the machine on, and while it's warming up for 30 seconds or whatever, you're telling the medic that's doing compressions to say, hey, when we go through this pulse check, I want you to restart compressions here in 10 seconds. You're looking at the medic that's controlling the airway or something and saying, hey, I want you to feel for that carotid pulse during the pulse check. Make sure you assign people with tasks. Maybe you assign someone to help you look at the monitor as well, because you might be kind of busy looking at the ultrasound screen for a second. So just prep everyone, and I feel like this actually goes pretty well, and the medics kind of appreciate doing this. And then you have your 10 seconds, you save your image, and then you have them hop back on the chest and start doing compressions regardless of whatever you see. And then you can kind of have a debrief session after that and talk about where you're going next. Last point that I kind of put on the bottom there is just remember to also look at the monitor itself. Sometimes they may not necessarily correlate. Maybe you look and you see fine V-fib on the ultrasound and it really looks like asystole on the monitor. But that also another scenario, you might look at the monitor and see that this is a PEA rhythm at a slower rate of 40 or something, and you look at the ultrasound and you see that there's pretty coordinated cardiac contractility that seems like it would correlate with a pulse. That is very helpful to know. So just remember to look at the monitor and kind of have that this mental walkthrough here of how this might go before you actually do it. So just some quick reminders based on some feedback we've gotten so far that might help you with troubleshooting some commonly encountered things here. Remember to check the batteries at the beginning of your Jeep shift before you really go out on a call. The carrying case has a spare battery. Locate it and know where the charger is, and make sure that your batteries are charged. Again, just like you're charging the radio overnight, just make sure to charge the spare battery if you need to do it. The thing that's really going to help you get multiple uses out of one battery charge is to fully power down the machine between uses. This is pretty easy to forget actually when you're on the scene and you just tap the power button and then you go bring the patient to the hospital or whatever because the screen goes black and you think it's off, but really it's just sleeping. And what you need to do to fully power it down is to tap and hold, and it's going to give you the option to tap then power off, and you'll see the machine then go through a shutdown period of a few seconds before it actually turns off. If you do that, you're going to be able to get multiple scans per battery life. Otherwise, if it just sleeps, next time you go to use it, it'll be dead when you use it. You'll have to switch out the batteries. Next reminder point is to save actual video clips. Remember to tap and hold that save button. It's again, when you're kind of amped up in the moment on the scene, it's easy to just tap the button. If you are doing it correctly and tapping and holding, you're going to see that save button kind of turn into a red bar filling up, and that's how you know that you're actually saving an image, or excuse me, saving a video clip that lasts for 6 seconds. You don't have to hold it for the whole 6 seconds. It'll just start to do that after you tap and hold for a second or two. Next one there, if you forgot to use a patient identifier, again, all is not lost. You can enter the info after you're done scanning on the scene. Again, you can review that earlier in this PowerPoint, or just email, text me, let me know. We can go over that. Next one, again, remember to bring it to the arrest, and remember to bring it to potential arrests. If you think that it's going to be helpful, it's kind of hard to use it if it's in the Jeep. So sometimes you're called to a respiratory arrest. That's a high-risk patient who may have a cardiac arrest. You should probably just bring it in with you. Just grab the book bag in addition to the blue bag. And then lastly, for charting purposes, if this was a cardiac arrest and ultrasound ultimately wasn't used because maybe you felt that it wasn't appropriate or helpful. Say, for instance, if you showed up and ROSC was obtained as you walked through the door and they're getting ready to transport the patient, that's totally appropriate. Just kind of let us know under the challenges section so that we don't have to go digging through the chart to kind of figure out that information. That's helpful to us. We've seen some other reasons being that family wanted resuscitation efforts terminated, or maybe that the battery wasn't working or you forgot to bring it in, what have you. All that's okay. Just kind of let us know so that we can figure out and kind of troubleshoot any potential issues. Coming in hopefully the near future, we'll have some images of cardiac standstill or some fine VFib. Just remember, when you're looking at some of these hearts, they're probably not going to look like some of the healthy hearts that you scan in the emergency department. So next step now, kind of take home point, just consider using the ultrasound probe here during your pulse checks with some of your cardiac arrests that you're called to. Remember to keep those less than 10 seconds. Prep the medics, kind of have a little mental walkthrough before you go out and do this in the field. Also, feel free to practice with the device before you go. That will definitely make things go smoother. And if you have any questions after going through this, just let us know. We would be happy to answer any questions that you have. Thanks so much. Good luck and happy scanning.